Hello, my name is Mary Davis. I'm a rising sophomore at Princeton University, and I have been studying for the past 8 weeks at Levolosi Healthcare Center in Arusha, Tanzania, with the help of Elected Africa and the International Internship program at my university. The reason that I wanted to do a pre-medical internship abroad is because I have traveled internationally in the past, and it really sparked my interest in other cultures and other languages, but I also am exploring a potential interest in the healthcare field and wanted to figure out if becoming a doctor and going to medical school was something I was really interested in, and I thought that Elected Africa offered a great opportunity to join those two interests together. I heard about Elected Africa through my own school's international internship program, which it offers to all the students at the university except for graduating seniors, and they had listed past students' experiences at Levolosi Healthcare Center, and it looked like a good place to gain a variety of medical experience. So to prepare to undertake the program, it was important to make sure that I had all my travel documents in order and that I had materials necessary to work at a hospital, like scrubs and some other basic medical supplies. It was also important to prepare mentally for 8 weeks in a country where you don't speak the language and I wouldn't know anybody except for my fellow students going in. And the arrival and orientation works so that basically you arrive at the airport and someone picks you up and drives you to your residence, and then within the next day they show you around the city and the local area, and you also get an orientation at the hospital with the hospital staff, walks you around and introduces you to the nurses and doctors in various departments to make sure that you are comfortable in the surrounding community and the hospital itself. I think Levolosi offers a great hospital experience because it has multiple departments, especially if you speak Swahili. There's a lot of places where you can go and interact with patients and see how doctors prescribe medications and treat patients. But even if, like me, you come in with absolutely no Swahili knowledge, there are definitely places you can go. I spent my first 4 weeks in the labor ward, and there I got to assist with some charting for patients. I got to assist in delivery and taking care of the babies after they're born. And I spent my last 4 weeks in minor theater doing wound dressing and stitch removal and things like that. And those are things that you can do without a knowledge of a ton of Swahili, although I'd still recommend trying your best to learn the language as you spend your time in Arusha. I think that what I've learned about healthcare in Tanzania is that it's different from healthcare in the US in that they try to do a lot of the same things that doctors do in America with fewer resources. For example, in America, once you finish using a set of tools on a patient to treat their injury, we immediately throw those tools away because they're contaminated. But in Tanzania, they just cycle through, they keep using the same metal tools and they sterilize them again. And it also works, but it's just a way to conserve resources in a way that we don't really think about so much in America. And I think that also the infrastructure for paying doctors seems less developed. So a lot of the doctors who work at Levolosi currently, who became friends with me, are younger volunteers who have to gain 5 years of medical experience volunteering after medical school before they can get a job. And so in that way, healthcare here is a lot more of the healthcare providers here come from very wealthy backgrounds, which isn't always the case in the US. And I think that while there are these differences between the US and Tanzania, the core of communicating with patients and making sure patients understand what is going on and putting the patient first is still a driving force in Tanzania in the same way that it is in America. Some of my favorite activities that I've done throughout my time at Levolosi and in Arusha have been outside of the hospital. We went to an orphanage one day and we just spent 3 or 4 hours playing with kids. I would take some kids and I would give them piggyback rides, and eventually I figured out that if I grabbed them by their ankles, I could swing them over my head and spin in a circle, and they loved that. And I think I did that for about an hour and a half, and I got so dizzy and they kept wanting me to spin, and that was so much fun. And I think also we did a safari outside of the program, and that was amazing. We went to the Serengeti, a place called Ngorongoro Crater that has an amazingly concentrated variety of biodiversity, and we also went to a place called Lake Manyara on our first day, and it was such a cool experience. And if you come, I definitely recommend doing a safari. And we also did some outreach to schools where we vaccinated some children against HPV. And it was really interesting to see just the structure of the schools and how the classrooms are different from those in America. I think the biggest cultural difference for me is that I'm someone who likes to be on time and to get things done within the time I allot for them. And in Tanzania, life is very pole pole, which is slow. And it's nice because it means that you take each thing as it comes, but it also means that you should be ready if you show up on time to wait for 45 minutes until the person who said they were going to come at 11 actually comes. And I think that was a big cultural shock. Also, I think that the gender relations can be different. The doctors at the hospital were sometimes very flirtatious, and it's not anything impolite or improper. It's just a cultural difference in the way that the relationships between men and women in professional settings are. And yeah, I think also just walking through the street, people will notice you, and they will say Mzungu, and it's not a rude thing. It's just saying, hi, I see you, and if they're a shop owner, it's like a, hi, come to my shop and like look at what I have. And just getting used to that took about a week or two, but yeah, those are the big cultural differences, I think. I definitely was very supported on the program. The place that we're staying is incredibly nice. We have a cook named Harriet who is so awesome, and if you ask, I'm sure that the person who's cooking for you will help you learn how to cook local food. I'm bringing back something called ugali, and I'm going to cook it for my family in America, and I'm super excited to do that because Harriet has showed me how. And also our on-program coordinator, Fabienne, would, like, if we locked ourselves out of the house or needed Wi-Fi reset or needed our water refilled, he was always available to come and help us, and he was super nice and super helpful. I think the biggest piece of advice I would give to someone who's looking to do a program such as this one would be to be aware that the place where you're going will be very different from the US, and the healthcare and the culture will have elements that can be shocking. And so just being aware that that will happen and you will feel surprised and uncomfortable, and it's okay, and that you should try and understand why things are done the way they are in this place and not judge it just because it is different or something that the US culture might deem to be bad. I think if anyone's looking to come, especially to Levolosi Healthcare Center for medical internships, know that, especially in labor wards, the night shift can be really great because in the day there's like 3 babies maybe, but sometimes at night shift there's like 10 or 11 babies. And you won't get a lot of sleep, but you'll see a lot of births, and you'll also earn a lot of respect from the hospital staff because it's a long shift and none of them like to do it really. And so I think that just like putting yourself out there and showing up for longer than you need to is something that's really helpful to making friends. And I'd recommend that you stay as long as you can at the hospital, and of course without ignoring the other cultural elements that you can find in your internship. Asante sana!